Hello everyone, my name is Maribel Fernandez and I want to welcome you to my video presentation in which I will provide an evidence-based paradigm for enhancing the quality of life for cystic fibrosis patients. Some telehealth limitations hinder care delivery, such as hindrance to physical examination and barriers to those with low access to technology by ET at 2021. Regardless of current technology, issues like failure to attend consultations, lack of medical experts in rural places, and restricted patient care continue to plague to health sectors. As a result, the healthcare system relies on innovation technology to support patients' necessity for convenience access to medical care from anywhere. This, this necessitates teamwork and synergy amongst research scientists and healthcare professionals to adjust to innovation and scientifically proven treatment and offer excellent care to distant patients. As a result, the discussion will concentrate on Caitlin, cystic fibrosis, patient and provide a scientifically proven treatment program to enhance her wellness and achieve good results. Let me provide some background information in Caitlin. Caitlin is a young girl of 2 years old. Her mother took her Valley City Regional Hospital, where she was detected to ill from pneumonia and hospitalized. It was the second time Caitlin had been hospitalized in VCRH in the last 6 months. She became ill again, and her mother rushed her to the doctor. The respiratory therapist gave her a nebulization spray because she was coughing, making quiet breath noises, and having rhonchi in upper lobes. The nurses also used a thoracic massage to keep her stable. She had weak respiration at 32, and her respiration continued through 65 milligrams of chloride and have temperature of 101. As for the test finding, she developed heavy secretions after the treatment following the nurse's examination. The doctor determined that she had cystic fibrosis. Dr. Erika Copeland, a pediatrician, suggested that penicillin be given by the nurse intravenous. Her caregiver, Virginia Anderson, also suggests that she will be issued with pancreatic enzymes and regularly monitor her temperature while the care team develop a treatment plan. Caitlin was in a fragile state that necessitated regular checks, observation, and proper treatment. Since her parents had split, it was a bit of challenge. She is presently residing with Janice, her mother, in McHenry. McHenry is an hour drive from VCRH, making it difficult for her to keep her doctor's visits. The senior doctor, Dr. Erica, and the rest of the healthcare practitioners, on the other hand, are sympathetic in Caitlin's situation and health consequences. Dr. Benjamin, a pediatrician at McHenry, is contacted by Virginia and Dr. Copeland about Caitlin's illness to discover a viable remedy to enhance her health. Result: Dr. Benjamin is well versed in cystic fibrosis, but the treatment alternates recommended by the VCRH healthcare staff are not available in Cooperstown. Virginia encouraged Dr. Benjamin to enroll in telehealth at the VCRH so that he may swiftly acquire medication and information services. Dr. Benjamin agreed to use VCRH telehealth because he wishes support to Caitlin whenever Caitlin required medical treatment. The entire healthcare team in charge of her care opted to confer through text messages, calls, and Skype. According to a Medline social worker in McHenry, Dodge Insurance would cover Caitlin's healthcare bills. Caitlin's mother was taught by health practitioners how to administer chest treatments in an emergency. The healthcare workers told her to observe her temperature and respiratory conditions regularly. Finally, they'll show her how to interact and plan appointment visits via Skype and urge her to keep track for all information about the child's progress so that she may receive an excellent treatment and enhance her response treatment. Now let me explain how the collaborative team used an evidence-based practice paradigm to help create Catalan treatment pathways. The Johns Hopkins Nursing Evidence-Based JHNEBP paradigm, together with accompanying guidelines and resources, was established by Johns Hopkins Hospital to help caregivers access recent evidence and convert study results into patients' treatment. 3rd 2018. The interprofessional team created Catalan's treatment regime using the Johns Hopkins Nursing Evidence-Based Practice Model, JHNEBP, was used to develop a problem-solving technique for making good clinical decisions on treating the controlling cystic fibrosis. The initial stage was to generate practice questions to improve awareness and abilities in identifying cystic fibrosis problems. For instance, which method is the most appropriate for administering drugs and monitoring clinical health status? How will Dr. Benjamin work collaboratively with VCRH medical team to avoid serious cystic fibrosis symptoms? What services are offered in McHenry to assist Janice in her consultation with the medical team? Is the library able to give internet connectivity if Janice does not have the services at home? Will Kathleen Mother's education reduce her daughter's chances of developing acute cystic fibrosis? The second stage was to consolidate information based on the practice questions to ensure that it provides a better answer to assist Kathleen in monitoring her cystic fibrosis and better her health. Summarizing evidence aid in the research, appraisal, and rating of proof efficacy and the measurement of evidence standards and recommends the most substantial evidence to include. The final stage was to apply the evidence to improve Caitlin's health by executing the best treatment that possible. Despite cystic fibrosis having no remedy, Caitlin's therapies include nebulizer treatments, thoracic physiotherapy, medicine treatment, and a healthier eating plan. The team's collaborative efforts help to prevent difficulties and regulate the cystic fibrosis symptoms. Her condition improved when the nurse gave her pancreatic enzymes and a higher calorie diet. In addition, integrating aerosol breathing and thoracic physiotherapy therapies in her treatment regime help clear mucus and keep her airway open, improving her lungs capacity. Furthermore, clearing her airways reduces her likelihood of developing influenza symptoms. The care team taught Janice about using Skype, which enabled her to confirm with Clayton's if she faced problems or not changes while giving care. The health practitioners coordinate and provide superior care even without Clayton having to attend the hospital via Skype and text messaging. In essence, the respiratory therapists use telemedicine to assist Janice in managing Clayton's cystic fibrosis by delivering information. Now, I want to discuss the most significant and vital evidence that the care coordination team used to judge Clayton's treatment regimen. The care coordination team should make an effort to stabilize Caitlin's health and coordinate the care treatment. Hence, the care team decided to construct a telehealth treatment for him. Give the long commute to Valley City Hospital. The telehealth program will enable her to avoid crisis and postpone visits, which may jeopardize her life. Patients may get medical services from nearly anywhere using telehealth by real-time video conference, LAN ET at 2019. People residing in remote places may benefit from telemedicine to enhance their health and manage prolonged illness. Finally, in the case of work group, I would like to examine the benefits and techniques of overcoming multidisciplinary cooperation challenges in the treatment plan. Caitlin got appropriate health care due to interdisciplinary partnership, which can critical in enhancing her quality of life. Janice made a vital step by seeking medical advice concerning the red marking on her daughter's chest. She sought advice ahead of time to see if it was due to a misunderstanding or of instructions and ensured that she was following the suggested care plan. Caitlin was able to obtain high quality care as a result of the concern. An appropriate care plan was devised at her convenience, exposing her continuous and proper care from both the hospital care team and her mother. One solution to multidisciplinary cooperation challenges is to increase the level of cooperation and coherence across different health, social care organizations, and employees to enhance the quality of care. Davidson et al. 2020. The planned care delivery arranged across health services to enable an effective healthcare delivery system has been termed coordinated care. For example, in Caitlin's case, medical practitioners from various levels in the VCRH and healthcare staff members in McHenry. Dr. Benjamin collaborated by telehealth to coordinate Clayton's care. The doctor, nurses, and social workers in VCRH worked together to find the best treatment care for the patient. In addition, healthcare institutions should employ electronic medical record systems, which encourage multidisciplinary teamwork by allowing all care professionals to obtain patients' records conveniently. Telemedicine and other similar services should be utilized in hospitals by care teams to help with interdisciplinary cooperation. Telehealth facilitates multidisciplinary collaboration and care coordination and improves patient-provider interaction. The references for this homework, it was Davidson R. Barrett, D. Erickson, Newman, 2020, how the integration of telehealth and coordination care approaches impact healthcare services, organization, structures and methods, mixed methods, JMIR Nursing, and then also Len R. L. Wilson, Stockton, and Russell and Johnson, 2019. CYFIT telehealth protocol for a randomized controlled trial on the online outpatient physiotherapy services for children with cystic fibrosis, pulmonary medicine. Tehar, 2019, translation of evidence for leadership in nursing and healthcare, translation of evidence into nursing and healthcare. And Vag and Shantikumar, Morrison and Chapman, Plan Beiji, Ranganaman, and telehealth virtual health monitor in cystic fibrosis, current opinion in pulmonary medicine on 2021. Thank you very much for your time.